Are you dreading starting your day because you have to stand up and walk, but you don't have a good balance? These exercises that I'm going to show you in this video will greatly benefit those who have a neurological disease such as a stroke, Parkinson's disease, or brain injury, and for those older adults over the age of 60 or retirement age. Maayong adlaw na tong tanan. I'm Nathan, I'm your occupational therapist, and my goal is to help you be more consistent with your therapy at home. A lot of my patients dread getting up in the morning or start their morning because they have a fear of falling. This is especially true among those who have experienced their first fall, and that is because they know the devastating effect, especially when they ended up in the nursing home or in the hospital or have a broken bone and end up hurting themselves a lot. So if you don't want to experience that, and if you know somebody who you love and you don't want them to experience that fall and ending up in the nursing home, let's start doing the morning balance exercise routine and just follow along with me. Right, just a reminder, please consult your doctor or your therapist to see if these exercises are appropriate for you. So like I said, these exercises you have to do before getting up from your bed, upon waking up. So let's lie down, let's pretend like you are still in bed, right? So we are going to start with some ankle mobility. So try to just move your ankles like this, pointing your toes up and then down, up and down. So you can just keep your legs down and move your ankles. This exercise is when you get up, you need to regulate your blood pressure, right? You might feel dizzy upon waking up and getting up from your bed to standing because your blood pressure will drop immediately because you were still lying down and then your body is not used to an upright position. So do some ankle movement before getting up. Now, next exercise, you're going to do a straight leg racing, alternating straight leg racing. So try to keep both legs straight, but if you can, just bend it a little bit, all right? So let's try to do 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. The next exercise to improve your balance upon getting up every morning is just a knee down. So you're just going to slightly bend your knees and try to bring that knee down. You can do it one at a time. You can also do it both at the same time like this. All right? So let's try to do both knees down back to your bed with your legs slightly bent. All right? So let's do 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. And that is knee down. That will improve the strength of your quads or the front part of your thighs, which is needed to lock your knees to keep that leg straight when you are standing up. After doing those 3 exercises, try to slowly get up from your bed. I know most of your beds will be a little bit lower than this bed. So we're just simulating using a therapy bed, right? So your bed will be a little bit lowered, but slowly get up and put your feet down on the floor. We are now going to do a sit to stand. So please try to use your hands if you don't have good strength yet, and then try to get up to standing position. Look for your bed, sit back down. All right? That will improve the leg strength. Both legs will get stronger, which is what you need to stand up much better with better balance and walk much safer. All right? So let's do 10. Push up from your bed, stand up. All right? Let's do 10. So this is 2, 3, 4, 5, 6, 7, 8, 9, 10. And that is sit to stand. Now, to bring that to the next level, if that got easier as time goes on, as you are being consistent with therapy, try to cross your arms across your chest, and you're just going to do the same exercise but without using your arms, right? So try to do that after a few weeks of practice. For the next exercise, you just need a pillow. So we are going to stand on a pillow. This will simulate an even ground. And these exercises, balance exercises, won't be very effective if it won't challenge you, if it won't make you feel like you're losing some balance. So we need to practice and challenge ourselves up to the point where it is that difficult, right? So let's stand up first on solid floor, solid ground. So you're going to step on a pillow and try to hold that position, that balance, for about 30 seconds, all right? And if that is easier, try to put your arms across your chest and try to maintain that balance again. So for about 30 seconds. This should give you a little bit more of a challenge because it is not solid ground, right? So this is your standing on a pillow. The next exercise is just standing on one leg. So when we walk, we don't want to be constantly just walking like this, where you are not picking up your feet. You want to really pick up your feet when you are walking, because otherwise friction will make you tired. This will cause friction. Plus, if you're not clearing your foot when you take a step, you'll have the tendency to fall because your foot will get caught on the floor or into a wire or a toy from your dog or a carpet. So try to practice this, a single leg stance, so that your body will get trained again that this is safe. When you take a step, this part of the gait is safe. So let's try to feel the bed. Practice this close to your bed and pick up that leg. One leg. Let's start with the right leg and hold it ideally for about 20 counts or 20 seconds. Now change legs. Now pick up your left foot and hold it for about 20 counts. If you need to, make sure the other leg is still feeling that bed so that in case you lose balance, you're close enough where you can just sit down, right? So hold that for about 5 more counts. 1, 2, 3, 4, and 5. Bring it back down, then slowly sit down to take a rest. The next exercise, we are going to be walking side to side. So stand up, slowly stand up from your bed. Make sure you still know the bed is close enough and try to walk side to side. If you need to feel the bed, you can do that, all right? Just walk side to side about 3 times every morning. You know what? There's a lot of my patients who will question me, why do you have to walk sideways? Well, if there is a narrow door and you are using your walker, you have to get in sideways, right? Or if you need to get something in between 2 furnitures, you have to walk sideways. So this is still very important. Right, after doing side to side, we are going to walk forward and back, still close to your bed, so that you still have that confidence that you will be safe in case you lose balance. All right, so let's walk forward. And then guess what? We are walking backwards too. So usually we walk backwards when we are going to the toilet or when we are far from our bed. We still have to take a few steps backward. It is just a good exercise to improve your balance. While you are walking, you gotta practice walking forward and some walking backwards. You still need to retain that skill of being able to walk backwards. A lot of my patients, especially those about 70 years old and older, I have patients who are even 100 years old. They are still wondering, why are you teaching me how to walk backwards? But it is still needed when I explain it to them. Like you have to go to the toilet, you're far from your toilet or from your bed, you have to take a few steps backwards. Anyway, those are the exercises. But before we say goodbye and start your day, I'm going to do the attendance check. Please type down below in the comment section, what are you grateful for every morning? Like, I am grateful for my bed. My bed is comfortable enough that when I wake up, I feel refreshed. Or you are grateful for the air that you breathe, or that you are just grateful upon waking up because you're still alive. So just type down below, what are you grateful for? All right, so how was it? It was easy enough, right? And you feel safe enough to start practicing those balance exercises upon waking up every morning. Now, if you find this video helpful, please share this video to your loved ones or to your support group, or try to practice this every day and give it a thumbs up. Click on the subscribe button. And if you have any comments, suggestions, or any questions, just type it down below in the comment section. Just a reminder, consistency is the key and never give up. Until next time, paalam! Zoom!